wedding music.
Please stand by. Good day and welcome to today's ANSI 5010 Ask the Experts webinar. At this time, I'd like to turn the conference over to Holly Wilson. Please go ahead.
Great. Thanks so much. Hello, everyone. Thank you for joining us this afternoon for what is the third in our webinar series around ANSI 5010, providing an opportunity for you, our customers, to ask your questions to our experts. I do apologize for starting a few minutes late. We have had a last-minute change for today's webinar. Tim Motley, unfortunately, is unable to join us. He is out sick today, so we have gotten two other experts to join us to be on the call to answer your questions. So they are Jeff Casimir and Chantel Arnold. So thank you to Jeff and Chantel for filling in here at the last minute. And then we do also have Lisa Height, who is our Metasoft and Litech product manager. So we've got the right experts here for you and are excited about the call. Before we get started, I just had a little bit of information to pass along to make sure everyone is grounded in what's going on currently in the industry with the 4010 transition to 5010. First off, the most important thing is to make sure everybody is aware of the 5010 compliant practice management systems that McKesson offers. So here on this slide, you see the list if you're watching the live meeting. In case you aren't watching the live meeting, I'll read them off. They are Metasoft version 17, Litech 2011, Practice Partner 9.5.2, and Horizon Practice Plus 12.5. So those are the products that you need in order to generate 5010 compliant claims. If you aren't on one of those releases and are having any issues with your billing, with rejections, et cetera, then certainly go ahead and reach out to one of our value-added resellers or to our inside sales team to get up to speed and up to date on your software. Once you are on the latest version of software, I also wanted to make sure that you realize that there are some things that you have to do in order to configure your system to meet to send 5010 claims. And if you are working with a value-added reseller, it's quite possible and likely that your reseller has already done this for you. But for those of you who buy direct from McKesson and do the implementation yourself, I just wanted to quickly cover these 4 steps. There are 2 very specific documents that walk through these steps in great detail with screenshots, both for Litech and Metasoft, and I will send those out to everybody who registered for today's webinar after the call by end of day tomorrow. So you'll get more specific instructions, but just to make sure everybody realizes that you do have to create a new EDI receiver in order to send 5010 claims. Once you create that new EDI receiver, you have to configure it in revenue management, and then once it's configured, you'll attach the receiver to the carriers that you want to send 5010 claims to. We do definitely suggest that you test a batch of claims for each of your payers to make sure that they get paid, and then it's possible that you'll need to, once you've done the testing, you'll need to revert back to 4010 for a particular payer if they are not currently live with 5010 or if they are in a situation where they're accepting both 4010 and 5010. So you'll just need to work through your clearinghouses and with your payers to determine who wants 4010 and who wants 5010 at this point while we're in this transition period. So quickly just wanted to kind of tell everybody what we're hearing out in the industry. There is a lot of noise and information out about this transition to 5010, mostly because of the 90-day window for the enforcement period, grace period, where payers won't be held accountable until March 31st, 2010, even though the turnover, the changeover did occur on schedule on January 1st. So here's a snapshot actually as of today based on the payers that work with our Relay Health Clearinghouse. So essentially as of today, less than a third of the payers are actually live on 5010 and only accepting 5010 claims. So there's a whole lot of other payers out there that are in this kind of dual state of accepting both 4010 and 5010 claims. As you can see, if you look at that third bullet down, there are 1,747 payers that are live on 5010 but still accepting 4010 and 5010 claims. So the reason that's important is that if you're using non-compliant software and submitting 4010 claims to your clearinghouses and assuming that they're getting up converted to 5010 and being paid perfectly fine, that may or may not be the case depending on whether or not that payer is allowing them to continue to send 4010 claims. So it's really important for you to work closely with your your clearinghouse and your payers to know who really is on 5010 and who is still making that transition as of, or up to March 31st. We do know that government payers, including Medicare, TRICARE, and some state Medicaid plans, are rejecting claims that aren't 5010 compliant, and we expect more rejections to occur as more payers switch to that live and only accept 5010 claims. We do know that ERAs are backlogged at payers that are live with 5010 as they're working the kinks out of their adjudication system. So even though your claims may be going through fine in 5010 format and getting paid, you may not receive your ERAs to know what you actually got paid for a few weeks because they are backlogged. And we do know that the up conversion and down conversion services that the clearinghouses are offering are causing some issues, particularly if there are multiple handoffs from the time you submit to a clearinghouse and then that claim actually gets to the payer. So those are just some of the things that the industry is really working through and working out. In terms of where we know claims are rejecting, these are some of the common reasons for rejections. So just so you kind of know, some of this is information that you capture in your practice management system, and some of it is some procedural things that you'll want to look at. The 9-digit zip code for billing provider and service facility location, that's the biggest one that's causing rejections, and it's very easy to fix. You can look up the 9-digit zip on the U.S. Postal Service website and then include that last 4 digits into your practice management system for billing provider and service facility location. If you don't have those 4 digits populated, what happens is the clearinghouses typically will put in a default number, so 000, 1234, et cetera, and those default numbers can cause rejections at the payer. In terms of the pay-to address, P.O. boxes are no longer allowed in the billing provider's street address, so you want to make sure that you move P.O. boxes out of that field and into a pay-to field if you need to include those. If you need to include P.O. box on your claims. Special characters, this is a real interesting one. We are hearing of rejections because of special characters such as a period, number sign, colon, apostrophe, dash. Those are primarily causing rejections in the provider, referring provider, facility, patient's name, and address fields. However, it might be good for you just to get into the habit in your practice not to include those characters in any field. So, for example, a hyphenated name, instead of using, first name hyphen or, first last name hyphen and then the second last name, just put a space between instead of a dash. So little things like that you will want to start to get into a habit of not including in your information, your data that's pulling into your claim. Also, NDC numbers are causing issues for all injections. They are now required on all injections, and there's a very specific 11-digit format. They have to be in a 542 format, and any NDC numbers that have fewer than 11 digits need to have leading zeros in a variety of places based on what their format currently is. So on this slide here, you can see the various formats and where that leading zero would need to go. And I should mention that this presentation deck will be sent to you, so you don't need to feverishly write this information down. You can have it for future reference. We also know that other payers are rejecting for a variety of reasons, so this is something that we expect to see more and more of as more payers move into the live environment. There will be specific things that each individual payer is going to request and require. So these are a few things that we've seen, but we expect more as we continue through this transition. So the patient loop should not be sent with the same information as a subscriber loop if the payer requires unique IDs for the patient and the subscriber. If the billing provider isn't the same as the rendering provider, then the rendering provider should be, that says should not be sent. It should say should be sent. I apologize for that. We'll get that corrected. And then some payers, we just talked about the NDC codes, that some of the payers are looking for those codes in the wrong places. So we're working with the payers to correct that and make sure they're looking for that information in the right place. So with that, hopefully that's at least a little bit of background information around what we're seeing, what we know are causing rejections, and we know that you guys are seeing rejections for a variety of reasons, which is why you're on the call today. So at this point, I do want to open up the phone lines and turn the call over to our experts to answer your specific questions. So operator, if we can prompt the callers, that would be great.
Certainly. If you'd like to ask a question, please signal by pressing *1 on your telephone keypad. If you're joining us on a speakerphone, please make sure your mute function is turned off to allow your signal to reach our equipment. Please be aware that a voice prompt on your phone line will indicate when your line is open. Again, *1 to ask a question. We'll pause for just a moment. We'll take our first question. Caller, your line is open.
Hi, my name's Elaine. I've got two questions. First of all, I don't know what you're talking about when you say the NDC numbers.
Hi, it's Lisa. I'll take those. Those are the national drug codes. So anytime that you deal anywhere with serums or injectables, there's an NDC code that's on the box that needs to go
I don't use those, so that answers
there
the
question.
You go. Also, in the pay-to address, the insurance companies are not using that address. They're using the physical address. Any idea why?
It's Lisa. I have a strange question. The address that they're sending the payments to, are they in box 33?
I'm plugging the address in where they tell me to, where McKesson's telling me to. And,
okay.
And in the pay to, it's supposed to be where you want your payment sent.
Right.
However, and that is my P.O. box. However, I'm getting them at my physical address, which is just a terrible address to get payments to.
I would suggest going back to that specific insurance payer and seeing what they have on file. They may have them flipped on their end.
No, this is all since we changed that. Since we changed the physical address on the provider address, this has happened.
Okay.
Never had it before.
Yeah. Then I would just call support and see if they can help you. If they can
call who?
Support.
Holly,
that number.
It doesn't matter. I can have that number 3 ways to Sunday. Nobody's going to pick up the phone.
Have you already tried them?
Ma'am, I have tried support for Metasoft more times than I can count. And the only way I can do it is to personally contact Holly Wilson, and she gets me there finally. But it is a living nightmare to call your tech support. Living nightmare. They don't answer their phones. They don't call back.
Then if you would just send an email either to myself or to Holly, and we'll see what we can.
Okay, I'll do that. Okay. One other quick question. I am getting a rejection notice when I am filing an old claim that hasn't been paid yet. They're sticking on the P.O. box still instead of the physical address, even though I've changed it. And I'm getting rejection through the clearinghouse, not the payer.
Also include that in that email to either Holly or myself.
Okay, I'm glad I spent this time. Thank you very much. That's all.
Thank you. We'll take our next question.
Yes, hello, can you hear me?
Yes.
Okay, when it comes to the 9-digit zip code in the provider's address box, with the zip code, does the dash have to be in there or leave the dash out? Because we have the 9-digit zip code in, but we keep getting an invalid zip code response.
This is Jeff. Let me answer that, go over that one. Now, as far as when you're sending your claims, is the place of service that you have on your claims in 11 for the office? Do you know?
Yes.
Okay, and are you sending your office as a facility?
Where would I find that? I'm just,
Generally,
our physical office is the billing entity as well?
Right, and that's probably the reason why you're getting the rejection is because the physical address for the billing provider is the same as the physical address for the facility, and if that's the case, then the facility loop should not be sent.
Okay, and how would I correct that, and under what screen?
Well, what you would need to do is go into the transaction entry screen for Metasoft and add the facility column.
Okay.
And then remove it from there.
So actually remove it from facility column.
Correct.
Okay. All right. Thank you so much.
You're welcome.
And we'll move on to our next question.
Yeah, hi, my name is Brian, and we're seeing a lot of rejections for any time there's more than 4 diagnosis code pointers on a charge line. I was wondering if you had anything about that.
Yes. Regardless whether it's 4010 or 5010, there's only 4 diagnosis code pointers allowed per service line. Everybody thought that with 5010 it was going to be more, but unfortunately it stayed the same.
Okay, do you know, is there any way in Metasoft, because when they enter the diagnosis code, it automatically, checks whatever diagnosis code pointer, if they have 5 or 6, is there any way that you know of to turn that off?
If you go into program options, I'm bringing that up because it's not something that I do on a regular basis, and go into data entry, you can enter there's a field for number of diagnoses, and you can just put 4 in there, and that will keep it from allowing you to enter in 5 or more pointers.
Okay. All right. Thank you.
Welcome.
We'll move on to our next question.
Yes, hello. My name is Mary, and I have 2 questions. When you say NDC codes are needed on all injections, do you mean all injections like, cortisone or testosterone, anything?
Well, as far as I know, if there's an NDC code on the box, it needs to be sent on the claims.
Okay, and where exactly does the NDC number go? Is that in the within the procedure code setup?
Yes, there is a field for, if you go to list procedure payment adjustment codes,
right,
and then go into the specific procedure, there is a field for national drug code.
Right. Okay, got it. Okay, so.
It says, it's listed out as National Drug Code.
Right.
You will see the abbreviations of NDC when you go into that. It's under the General tab.
Right. Okay, I see it. Thank you. And my other question is, I need to know how to or what a loop is. We are getting from Colorado Medicare anything that has the J code, an injectable of J3301, for example, which is what we use a lot of. It's coming back telling me that it must include a description, and it's referencing Loop 2400.
Loop 2400 SV 101-7.
Right.
Yes, and that's a defect that we had. Well, actually, it was first a defect with Medicare. Their edits were messed up. So we made a change to the Metasoft program to send that description, and now Medicare changed their edits so that they don't want to see that description anymore. Making things tough on us.
Yeah.
But just to let you know, there's going to be a new build of revenue management released this Friday evening, and that will have a fix for that so that that description will not be sent. As long as there's an NDC code being sent on the claim, then that description will not be sent, so that should resolve the issue.
Okay, so like for the ones that I've been holding back, I can just enter the NDC code and then send them today?
Not today, because unfortunately today it will still send that description along with it. you'll need to wait until after the new build of revenue management comes off Friday evening.
Okay, and so is that something for Medicare, or it's I'm not following what you're telling me.
It's for Medicare, all carriers, actually.
Okay.
So on Monday when you come in, you just need to go and check for updates, and it will automatically update it in your system under RM, and then you can send them out on Monday.
And
Okay.
Lisa, can you remind everyone what they need to do to check for updates, because that's a very important point that
Yes,
we are
please.
making changes to revenue management.
Yes. Thank you.
I'm trying to get into the specific window. Jeff, do you have that up?
Yeah, actually, I can go over that. There's actually a couple of different ways that you can check for updates for revenue management. You can go into the revenue management program itself, and once in the revenue management program, click on Help and check for updates. Or you can also go to click on Start, All Programs, Revenue Management, and check for updates there.
And you're talking about the revenue management under activities?
Yes.
Yes.
Okay. Okay, and could you say that, the last thing you said, could you repeat that? Go to Start and All Programs?
Correct. Then Revenue Management.
Okay.
And then in the submenu is a Check for Updates link.
Check for updates. Okay. Great. Thank you very much.
We'll take our next question. Caller, your line is open. Hearing no response, we'll move on to our next questioner.
Hello.
Oh.
Hello?
Yeah, hi. I have a question regarding the secondary claims. All the payers, none of my secondary payer claims are going through. I get invalid non-covered amount, or CAS amount cannot equal 0.
Okay. I can handle that one. That was, well, that's another edit that the carrier started, well, Relay Health started putting in just about 10 days ago. But we have created a defect for that, and the defect, the fix for that will be released in the build that is being released on Friday evening.
Thank you.
You're welcome.
I have another question.
Okay.
For the accident date for the Blue Cross, when I enter the accident date in the claim, and all my bills with the Blue Cross payer are rejected, saying missing accident date, even though I entered the accident date.
And that one I would recommend calling into support so that we can look at the file that was sent to make sure that it is being placed on the file.
Right, but I've been trying for past 2 months. Every day from 9 to 5 p.m. I'm on hold. And nobody takes the message, nobody returns the call. It just goes on a, hold. That's it. I don't know what else to do.
And if you would like, you can you can either email myself, Lisa Height, or Holly Wilson, and we'll see what we can do to get that to support for you.
Thank you.
And Deanna, can you please remind everyone what they need to do in order to ask a question?
Certainly. Again, it's *1 on your telephone keypad if you'd like to ask a question. And we'll move on to our next caller.
Yes, my name is Jan, and I'm getting a lot of rejects for leading spaces are not allowed, but when I print the claim off, I'm looking to see where the leading spaces are, and I don't see anything.
Jeff, have you seen anything like this?
I have not seen anything like that at all.
It's in the numbers behind it are N302 Loop 2010BA.
It's in the patient's address. It sounds like there's additional spaces in the patient's address.
Okay. The other one I'm getting, I guess the non-specific procedure code you said is going to be taken care of. 2310B is another one that I'm getting an error on. Loop 2310B.
And what is the error that you're getting?
NM108 was found, but NM109 was missing. X12 syntax rule P0809. If one element is present, all must be present.
That's for the rendering provider, and it sounds like the MPI number is missing. Now, when you go into your Metasoft program, if you go to click on Lists and go to Provider and Providers.
Okay.
And find the provider that is rejection is being sent back on. Double click on it to open.
Okay.
And then if you go to provider IDs, do you have a long list of provider IDs in there?
No, I'm not able to get in there right now, but I'll go check it and see.
Okay. Well, once you're in the provider IDs tab, find the insurance carrier that you're sending those claims to and see if that MPI field is populated.
Okay, that's all I have. Thank you.
We'll move on to our next question. Caller, your line is open. Please depress your mute function as we are unable to hear you. And hearing no response, we'll move on to our next questioner.
Hello. Yes, I'm having a lot of problems with coming back, a lot of rejections coming back with invalid SUB, CLM, filing, IND, code, MA.
Are you sending institutional claims to Medicare?
We're sending, yes, this is to the fee-for-service Medicare.
Okay, it sounds like the claim filing indicator is incorrect. It's probably sending MB, which is for Medicare Part D, when it should be MA for Medicare Part A.
And how do I go about fixing that?
Sounds like you might have stumped the panel.
Well, it stumped me too. And there are we have lots and lots of rejections. I have a huge amount sitting out there that can't go anywhere. And I'm like everyone else. We don't seem to get any help. We ask, and we're not getting any help back.
If it's not already coming across in your system, you may have to call into support so that we can hard code it into your system so that it will pull for those certain claims.
Okay. And another thing I'm having is the other subscriber claim filing IND, BDMA. Would that be the same problem?
That's the same exact problem.
Okay. And then another one is SL description required.
That's the one that the caller before was talking about where Jeff was explaining about the Medicare wanting the description for the procedure code, but then they no longer want that description anymore. And, of course, like you said before, Friday that bill will be released.
Okay. So this other one you said I just need to put in a ticket?
Yes, and then we can hard code it into your system.
Okay, and what does that involve, hard coding into the system?
We will need to have access to your system, and then we can go in and make the changes for you.
Okay. All right. Well, I have a large number with that denial on it, a lot. You can. And do you have a turnaround time that you think our ticket may be answered? because we put one out there and it'll stay out there for months.
And I do apologize for that. We have been extremely backlogged with the changes for 5010, and it's not, just us that are backlogged. Whenever we have to contact the payers are backlogged as well. It's just with the whole 5010 change, things got a little out of control, but we're currently in a state where we're pulling everything back in and everything's starting to calm down. So all of those backlogs, we're currently working on it to get it taken care of, and hopefully support will go back to normal soon.
Okay, I'll put a ticket in, and thank you.
And Jeff, this is Holly. I have a quick question that came in online. Is there a way for us to publish a list of all of the fixes that this revenue management drop that's happening on Friday fixes?
Generally, after it's released, there are release notes that are sent out as far as where we can. Well, actually, with the new releases, documentation is going to be in the help files with revenue management. I just remembered that that's something that they just started with the last build.
Mm-hmm. Okay,
so,
great.
And we'll take our next phone question.
Hi.
Caller, your line is open. Please depress your mute function as we're unable to hear you at this time.
We're a small acupuncture business, and we are wondering how much this will affect us. Will our codes be changing, or?
No, codes shouldn't be changing at all. As long as you're using the revenue management program and the 5010 implementation guide, once everything's smoothed out from our end all the way through to the carriers, you shouldn't have any problems at all.
Okay, because we send in some electronic claims, but they're processed through MD Online. We're not really using the revenue management function on the MetaSoft.
Okay. Then as far as when you're sending those claims, you're probably sending print image claims, an image of the claim file.
Mm-hmm.
And generally in situations like that, MDON will probably be doing the up-converting to the 5010 to send it off electronically.
Okay, that's what I was thinking. As far as our paper claims, is the main thing that we need to do is just make sure we have the 9-digit zip code?
Yes.
Okay. Also, we had a question about, do you know anything about the fact that the insurance companies rejecting claims because we're not an MD doing acupuncture?
I'm not familiar with that, unfortunately.
Okay. Yeah, what other things do you want to? Yeah. Yeah, so the 25-mile radius, they will put the claims through usually if you're just an acupuncturist. But if you can find somebody else that's an MD, they won't pay your claims.
Interesting. I've never heard of that before, to be perfectly honest with you.
Okay. What else? Let's see. Okay, I think that's all we have at this time. Thank you.
Thank you.
We'll move on to our next question.
Hi, I have a question on kind of a couple steps back. We need to create a file so we could actually test our claims to see if they are 5010 compliant. How would I go about creating a file so I can upload it into another website?
As far as when you're saying a file, are you talking about to do a print image, or are you talking about using the revenue management program?
We actually don't have the revenue management. We purchased the whole version 17, and then now the guy that we bought it from is telling us kind of to hold off, and we didn't know we had to buy another program and all this stuff. So he's having us pay
the revenue management program is part of version 17. You don't need to buy anything else. Now, who are you sending your claims to?
We send them kind of direct. It's called EDI, Meridian EDI, and it sends it straight to Blue Cross and Medicare of North Dakota.
All right. Then I would imagine it would need to be in. Do you know if it needs to be in an ANSI format?
Yes.
Okay. All right. Then, as far as to send a test claim or a test batch for those, here, and this will have to be done in the revenue management program, because that's the only thing that's going to build your claims in the ANSI format. When you're going through the connection wizard to set up your revenue management program, and you get to the edit receivers window, there's an option to a checkbox for test, and you can check that, and it will send it out in a test format so that the claims will not be processed.
Okay, the way our billing where we send it to, they made a website that we have to upload a test file into. It's called Total Onboarding. So the only way we'd actually be able to create a test claim is this revenue management.
If it needs to be in the ANSI format, yes.
Okay, so if we have it, we purchased version 17, but our people are saying that we need to purchase this other software now. It doesn't come in version 17.
Who is telling you that?
The people we bought it from, or MediSoft from.
All right. Well, with version 17, the revenue management program is part of the MediSoft 17 program. As far as the direct connections to Meridian, generally there isn't any. As far as the setting up the ANSI to send the ANSI claims, there isn't any different configuration you would need to do, but as far as configuring the program to send directly to Meridian, you would probably need to get some information from Meridian as far as their direct number, so on and so forth, so that you can configure that correctly.
Okay. Well, when I talked to them, they didn't know how to help us, so we kind of sent everything to our MediSoft dealer where we got them from, and they downloaded everything, and they can't figure it out either. So we are running 15 right now, and he's telling us to hold off. Because everything's billing out right now, and so he was going to try and figure a way to, all we had to do is create a test file and then put it into this website, and then it would kind of test it for us. So we have to do the 17 is what you're saying?
Well, if you want to be able to send your claims in the 5010 format, yes.
Okay, so the version 15 will not do it at all?
No.
Okay.
We'll take our next question.
Hello? Hello?
Hello.
Yeah, hi. I have two questions. First question is, if patient has PO box number, address as a home address, then is insurance going to deny or no?
That's a good question.
Hello?
It's just a billing provider that they're concerned about with the PO boxes.
Yeah, if the patient has it, we haven't seen any rejections with regards to that. It's just the provider themselves.
Provider and facilities, we have to make sure they have 9-digit zip codes.
Correct.
Yes.
right? And if we have lot of patients and sometimes we have to just resend the claims, we have to put 9-digit zip code for every of our patients or no?
For the 9-digit zip, it should, again, it's just the billing provider and the service facility that they're concerned about.
And what's about insurance companies?
No, just the provider and the service facility.
Provider and service. Okay then. Thank you so much.
Provider and facility.
Provider and facility. Okay, thanks.
We'll take our next question. Caller, your line is open. Please depress your mute function. And hearing no response, we'll move on to our next question.
Hello? Hello?
Hello?
Yes, I have a question. I'm calling from Beaumont, Texas, and I'm just trying to figure out, when is MediSoft going to update the claims on the left heart cath, the 93458, which have to be pushed through separately? Hello?
Can you repeat the question again?
Yes, I'm calling. I use MediSoft, and we're using the new codes that were put in at 2011 for 93458, 93459. They're still not accepted by MediSoft. Are they going to be adding these codes? These are old codes now that are still not accepted.
Are you saying accepted as the claims are being rejected for it, or you're not able to enter it into the software?
We have to push them through the software. We have to say that they're not accepted initially, so we have to push them through.
Not accept. When you click the save, it's saying that it's an invalid CPT code?
Exactly.
Okay.
Is that when you check your claims?
Yes, when we check the claims, they come back as an invalid code. These are codes from 2011 that are not recognized. We have version 17.
I have not heard of that. So if you would send me an email, my name is Lisa Height.
Okay.
And you and I will talk offline and see, because that's the first that I've heard about 9 codes not being in the code set.
Right, exactly. That's what I was trying to figure out. So,
yeah, no.
What our vendor has told us is just go ahead and mark them and send them through. But I'm wondering why we're still doing this from 2011
right.
code. So what number do I call you at?
If you send, I think on the live meeting you've got the MediSoft info website.
Okay.
If you just send an email to them, then it will come to me.
Okay.
My name is Lisa Height.
Okay. All right, thank you.
On to our next question. Caller, please go ahead. Please depress your mute function as we're unable to hear you. Hearing no response, we'll move on to our next question.
Yeah, hello. This is Brian. I had a question about facilities sending the NPI numbers. If they have a facility that doesn't have an NPI, is there any suggestions in that scenario?
No suggestions. Any facility should have an NPI.
Okay, and one other question is, I was told by support that the help menu in MediSoft, where you can the loop in segments, they told me that in 17 that's not 5010. Do you know is that correct?
That is correct.
But it's actually 10.
Right. It's being worked on to be updated. It isn't that far off, but it's not 50-10 completely.
Okay, thank you.
We'll take our next question.
Hi, this is Kathy. I'm from Maine. Can you hear me?
Yes.
Hi, Kathy.
Hi. I have a question. We're having a really difficult time with Medicare here. They keep rejecting everything. And I get a 2110 error that says Loop 2110, Service Payment Info, the reference. It's kicking back the modifiers, which is very odd because these modifiers have been around forever. And is anything going on that you know of?
I haven't heard of anything dealing with that particular loop and segment as a rejection. Do you happen to have the exact rejection message in front of you?
Yes, I do.
What's the exact message?
Okay, it's code number 4, and it says the procedure is inconsistent with the modifier used, or a required modifier is missing. And it says, note the 835 Healthcare Policy Identification Segment, Loop 2110. And when I call Medicare, they keep telling me, well, it's the wrong modifier. And I said, no, it's not. I've been online to double check. I've got my book in front of me, the same modifier we've used for years.
That may actually be something that you may want to take up with the payer, because if they're rejecting that information and you know that it's correct, I would say if you do you have the information? I know you mentioned you looked it up online. Did you happen to look at the AMA website to get that information, or where did you look? Okay, I would take that information to Medicare and say, hey, look, this is what's on the AMA's website. This is what you have to use to go by.
It might not work, but I'll try. I mean, we haven't been paid since October. I've been fighting with them all this time.
And are you going through a clearinghouse? Are you going through Relay Health, or which? Are you sending direct to the payer?
No, I don't know. We got that Section 17 of the version, and I don't know. We're working with somebody. I think it's the MD one.
If you're going through a clearinghouse, you can most certainly ask that clearinghouse to back you up, as you to work with you with Medicare to get them to look at that, because sometimes you can receive a little pushback from Medicare as far as what they will assist you with. But if you have that other entity with you to back you up with it, they will most likely give you more of an answer or tell you more information on how to correct it.
Hey, what I really think is the problem, though, is the doctor that I work for has got the DDS, but he's also MS. So what we don't process anything through dental. It's all done through medical, and they keep crossing, and we have to keep correcting them, saying, no, it's medical, because he is a TMJ specialist.
I'm not sure that would cause that claim to reject for that reason. I would definitely, it's something that definitely needs to be looked into a little further, more than, what we can do on the call right now. But it definitely does need to be looked at. And if you are going through a third-party clearinghouse, I would definitely say get with that third-party clearinghouse and have them to look into that with you as well.
Okay. Thanks.
We'll take our next question.
Yes, hi. You were talking earlier about the special characters and the provider address, the 9-digit zip code. How would we know if this claim is rejected because of a special character or because of the zip code? would it be that the electronic claim would not go to the clearinghouse? Would we have an error message that we can see, or is it just that the insurance will never receive the claim and we will have to figure it out?
Usually if it's rejecting for an invalid character, you will get the error message back telling you that it's an invalid character, and Relay Health is, or really, the clearinghouse Relay Health, I'm not sure if that's who you're going through, but they're very good about telling you exactly what that invalid character is.
Okay. We've been sending, I think, in the address of the patient, there are characters. We're not getting any error message or something, so I just wanted to check whether when it gets through, it means it's fine, that it's not hidden somewhere, any problem. Okay.
If the claims are being paid, then I wouldn't be too concerned about it.
Yes, okay. And what is exactly the revenue management program? Because I tried to go to activities, revenue management. It says file revenue manager.exe not found. Is it something that that is there in the regular
what version of Metasoft are you using?
The 17. Is it something that is supposed to be there and is not there? Or?
It should be. Have you updated to Service Pack 1 or anything, or Service Pack 2 for that matter, or 17?
I'm not sure what Service Pack. Is there anywhere where we can check that in the software?
Yeah, in your Metasoft program, in the menu that goes along the top, go all the way to the right to click on Help.
Okay.
Then in the new menu, go all the way down to the bottom to About Metasoft.
Okay.
And it should say the version.
SP2 I have.
SP2. Interesting. Yeah, we'll need to.
Well, it was installed by our reseller, so we bought the version 17 through our reseller, and he did the upgrade. We used to have the previous version, 15, I believe, or 12.
Okay. Yeah, it's something that you need to have us take a look at, because in previous versions, if you didn't have a serial number for the revenue management program and weren't able to get set up that way, then you might get that information. But in 17, it should go real smoothly.
Okay, it's something included in like the regular version. It's not an additional package.
Correct.
Okay, and what is it about? What is the revenue management program?
The revenue management program is a program that takes the information from the Metasoft program and creates claim files in the ANSI format so that they can be sent electronically to the clearinghouses or directly to the insurance carriers.
Okay. We've been doing that fine, so I don't know. We've been sending claims electronically, so okay.
Okay, who do you send your claims to?
To Nginx, Optum Insight.
Okay, do they have an add-on, or do you send the print image claims? Do you know?
Print image? No, I think it's we have the loops. Get into files with loops. like 23A or 23NB.
Do you know if the clearinghouse that you're sending to, did they provide you with a program to create those claims? Do you know?
No, that I don't know. Okay, so maybe I should be asking our reseller how he installed that part.
Yes, that would be the best move.
Okay.
We'll move on to our next question.
Thank you.
We'll move on to our next question.
Hello. Yes, I have a question regarding a consultation done in the hospital. We used to bill it as 99254, and for last year or two they have been rejected, and somebody told me then it is as 99223. Is that correct, or? Hello?
And I don't have access to the specific procedure code information.
Okay, my next question is between 2011 and 2012, the Medisoft program, when I go into revenue management, it tells me to upgrade to the new thing, but if you do that, you won't be able to bill the old claims. So is there a way, so far I've been waiting for 15 days to finish up old ones, but is there another way to, if I upgrade?
When you say old claims, are you referring to the 4010 ANSI format?
Right. Yeah.
Okay.
Because right now it is taking it.
Now, there's still a way to do that. If you go into your revenue management program, and if you go to configure receivers,
configure receiver, okay,
and then find the receiver that you use to send claims with, and go to the transaction column and click on the transaction column.
Okay.
You'll see the field for iGuide.
iGuide, okay.
Right. And when you put your mouse pointer over the field where it says outbound claims, what is it saying?
Oh, let's see. So go under revenue management and go under configure.
Right.
Okay. Okay, on configure, it gives me the receiver. Let's see. Okay, receiver. And on receiver, it gives me NDC.
So highlight that and then go to the transaction column.
Transaction column. There is no transaction column, or maybe it is on the other side.
Yeah, it's pretty much all the way to the right.
Send. Transaction column, yeah. It says claims only for the first one.
Okay, click on
other
that.
three are old ones.
All right,
so
click
if
on
I click
that
on the claims.
Yes.
Okay, it tells me iGuide, outbound claims, IG type claims,
all right,
description.
now if you put your mouse pointer over where it says outbound claims, what is the full description?
Outbound claims, it says MS175010 proof claim direct connect.
Okay. If you want to change your program back to send 4010 claims, what you'll want to do is click on that drop-down arrow there for the iGuide field. And in the list you'll find it's going to be a long list, and you can expand the window so that you'll be able to see more. But what you'll want to look for is outbound claims, MS17 Prof Claims Direct Connect.
Let's see. I'm not able to find that. Let me go back in again and say outbound claims. So I click on iGuide.
Yes, and where
And
where it says,
okay, it says claims to 51010, and you say find the one with 4010.
no, it doesn't have the 4010. It's just going to say outbound claims, MS-17, professional claims, direct connect.
MS-17. Professional Claim Direct Connect. Yeah, I found 3-4 of them. There are about 4 or 5 of them. Did I just click on first one?
Well, you'd want to select one that says MS-17, 5010.
Yeah, they're all MS-17.
Yes, but it says PROF claims direct connect.
Yeah, there
nothing
are
nothing after
4
that.
of them have Direct Connect.
Is there anything after the direct connect, though?
Well, let's see. No, that didn't work. Okay. No, it's not taking it. So this is only if I want to change it to 4010. If I don't want to, I can just keep it alone. Because right now my old ones are going through also as long as I don't upgrade.
Okay, then it just leave it as it is, and you'll be fine.
All right. Okay. I just kind of felt, what if we find a few claims that were old, but then I have to go back to your outbound claims and try it. Okay, thank you.
Thank you.
Deanna, can we get a quick check with how many we still have on the line? We're past our scheduled end time.
Certainly. We do have 7 questions left with 40 participants on.
Okay. We'll take a couple of more, and then if you are unable to get your question answered, on the screen there are 2 email addresses. If you'll email your questions, we'll get those answered via email. And for those of you who may not be looking at the screen, it's metasoftinfo@one.mckesson.com or litechinfo@one.mckesson.com.
And we'll move on to our next question. Caller, please go ahead. Looks like that caller has dropped out of the queue. We'll move on to our next questioner.
Hello?
Hello?
Hi.
Hello. I have a question regarding, earlier it was mentioned regarding sending paper claims that you needed a 9-digit zip code. And I was told from Metasoft in Denver just earlier, well actually last week, that on the paper claims they haven't changed and we only need the 5 digits. So I'm a little bit confused.
The paper claim function shouldn't have changed. I don't remember. Maybe they were talking about print images. Is that what you heard earlier?
I just know, I heard the lady say that she was from a small acupuncturist office or something, I believe, and she asked regarding paper claims if they just needed a 9-digit zip code to go on there. And I believe it was Jeff, is the person's name, said, yes, that's correct. And so I was wondering to clarify that, just because I've been told by Denver that the paper claims portion had not changed. It was only the electronic submission claims that have changed. Because right now our electronics are good, but our paper claims, I'm noticing, only have the 5-digit zip code. And he said that if we needed to add that, they'd need to come in and do it, help us do it. I just need to know for sure whether that's needed or not.
The 5010 change is all it's all for electronic claims.
Okay.
So those requirements that they read off earlier, they're all for electronic claims. 5010 is for electronic claims.
Okay. I just want to clarify, make sure that we were still doing everything the way we needed to be doing it, and it sounds like we are, so that's a good thing.
Yeah, and this is Holly Wilson. I'll just add, I think there's some confusion, too, because we talk about paper claims, but then we also talk about print image. And so if you're truly doing the paper claim, then you're right. That paper form has not changed, and it's still a 5-digit zip. But if you're doing print image, then the clearinghouse is converting to a 5010 claim, electronic claim, then that's where you would need the 9-digit zip.
Okay, and that's what, what we're filing electronically, which is the majority of our claims, is being done that way. But on the paper claims, which like our secondary and tertiary, that sort of thing, we send out via paper. And I thought, and maybe I misunderstood her question too. Maybe she said print image, and I thought she said paper. So maybe
it is a good clarifier for sure.
I just wanted to make sure. So okay, thank you so much.
We'll move on to our next question.
Yes, we are a rural office, and we have 2 nurse practitioners that work under one of our physicians. He's their preceptor. And before the 5010, everything that went out under him. And now it's going out under the nurse practitioners, and then the insurance companies are rejecting them. And we were told that if we put in there the supervising physician, that would take care of that, but it's not taking care of it.
And what rejections are you getting?
It's just got the physician is not valid or not associated with the facility, or we need an authorization for the physician or whatever. It's just denying all of those claims that the nurse practitioners do. And before, it just all went out with the information under Dr. McElmurray, who is their preceptor. But now it's going out with their information, and the insurances are not acknowledging it.
And your nurse practitioners have NPI numbers assigned to them?
Yes, they do have NPIs. Yes, they do. It goes out under our group NPI. Everything should be going out under our group for the rural billing.
So the carrier is just not liking the rendering provider that's on the claim?
They're not liking it's going out as the nurse practitioners themselves, and they're not liking that. They're denying all the claims.
I believe with that situation, we would actually need to look at your software to check your setup. And it sounds like a setup issue that we would need to just go into your software and look at how your system is set up.
Okay. So is that something I should put a ticket in, or how should I go about that?
You can definitely put a ticket in, as well as call into the support department. If you want, usually later in the day is when the calls start tapering off. So if you want to give it a try, you can go ahead and call into the support department and have someone log into your system and look at it now.
What we have a problem with a lot is not very many of the technical support are familiar with how rural billing is done. It's done totally different than other offices. And we run into the problem that they're not understanding what needs to be done for the rural. So this is billed totally different than just a regular office. Are you familiar with rural at all?
Yes, it sounds like what you need to do. You just need an override for all of your nurse practitioners to have the. When you bill your nurse practitioners, is it the same provider that's overriding them every time, or no?
Yes, it should all go out under the one provider. Yes.
Okay.
Yeah, it was fine until we upgraded to the 5010. I mean, it was working wonderful until we did this, and now we're just having the problem that the insurance companies are denying every one of them.
That is something that we would have to go into your system and correct, but it sounds like we just need to set it up so that your main provider is overriding your nurse practitioners.
Okay.
And that also sounds like, thanks, a great opportunity for us to help educate our support staff of that there are just other, besides professional, there's also the rural billing that they need to be aware of. So thanks for that opportunity to help educate.
Okay, thank you. We would appreciate that.
All right, great. And Ms. Wilson, would you like to take another question?
I think at this point we're at 5:15. Why don't we go ahead and end today's call? And again, for anybody who might still be in line and we didn't get to your call, I apologize for that. But let's have you please send your question into either the Metasoft info at one.mckesson.com or LITech info at one.mckesson.com, and we will work to get your questions answered via email. So thank you very much to everyone for your participation. Thank you to our panelists today, and a special thank you to Jeff and Chantel for jumping in and covering for Tim. So thanks, everyone, and we'll talk to you again soon.
Ladies and gentlemen, this does conclude today's conference. Thank you for your participation.